It's Wednesday night, and we're live from Oakdale, Washington, in the Educated Touch studio. Welcome to Ethics Outside the Box, with your host, Nathan Nordstrom. Special guests include Laura Ellen and you. Here he is, Nathan Nordstrom.
Hello, everyone. It's nice to see you again this week. We are live in Texas instead of the Oakdale, Washington studios, but I am excited because I get to be not only with, but not a head sticking out of Laura's head. So I'm grateful for you to join me, Laura. One thing that I have to say as an introduction to this wonderful person is, if you don't know Ms. Laura Allen, you've been hiding under a rock in the massage therapy industry. I have no clue how many articles you've written, how many books you've written, or how many webinars you've done. I mean, you've done just about everything I can think of. How many books have you put out, ebooks and regular?
12 or 13. I don't know, 12 or 13.
Then I feel better if you don't know, because then me not knowing really makes sense.
I was looking around yesterday on my bookshelf, and I'm going, I've written several books that I don't even have a copy of. It's time for me to get some more.
We got to get the print version of this. Let's go. Awesome. So, Laura, thank you so much for joining me today. Does everything sound good still?
Sounds great to me. Thank you.
Awesome. The other thing that I have to really kind of draw back to history, one of my favorite moments in going to a conference was going to, it was a teaching conference, if I recall correctly, and AMTA had just done something that spurred the fire with a little bit of angst. And from the back of the room, I heard sweet Laura Allen's voice speaking up about what she believes in. And one of the things that I've always just appreciated about you is that you don't pull punches. You're always willing to let people hear, and you're not judgmental in those things. You respect people. And so when I was the face of AMTA, I always knew that you'd tell me what you thought, and I respected that, and I was grateful for that. But I always felt your respect for me, and so that's always been a wonderful piece that I just wanted to applaud you for, was being able to hear your voice and really instigate questions and instigate the things that people want to know, and really asking people to think about things. So that just goes back to history, but you've always been an outspoken person for a profession, and I'm so grateful that you said yes to join me today.
Well, thank you for having me, and that could have been any meeting, because I normally would say what I think at any meeting. And I would always give, for many years I blogged about the politics of massage and all of our organizations and all that. And I would always give those, the leadership of those organizations, the opportunity to comment. I would say, look, I'm about to say so-and-so about you. Do you want to reply? And the majority of the time they did reply. And I can only think of one person who wasn't really gracious about it. And I'm not going to call their name right here, but sometime when we're alone, I'll tell you who it is.
Done. Now publicize, we're good with that. Yeah, we but I really appreciate it, because you know what, even with the effects of just kind of where the profession is, a lot of that stems from people asking the questions that really progress towards group understanding by everyone asking the right question. So thank you so much for doing that. Today's wonderful webinar is actually done in the morning, and if I had my choice, I would do a morning show with Laura Allen any day, because the smiles and the laughs that you have seem to always be contagious, and that's what I see a morning show DJ really almost always having. So thank you for joining me and keeping everybody awake and excited on this great topic. With the topic, let's actually go to that so people can follow along. My first piece for everyone is to go to the National Certification Board of Therapeutic Massage and Body Workers website by going to NCBTMB.org. We're using their model for the standards of practice and the code of ethics because it's something nationwide that's similar. Each state has their own little twist on these things, but a lot of them are similar. Laura, have you noticed any sweeping changes or interesting changes in different local areas?
No, not really. And you know, I've actually been following the regulation of massage therapy for almost 20 years, because on my very first job, which was in the massage land, which was as the administrator of a massage school, I actually was doing that just for a few days. I took that job, and then I took a wild notion that I was going to go to massage school. So the owner of the school that I attended was actually on North Carolina's very first when the board was formed, and so I actually assisted her a lot in writing getting the rules from other states that were already regulated and that kind of thing. And helping her craft, proposed rules for North Carolina. So I've been interested in this for a very long time, and every once in a while, one of the organizations updates their code or makes a little bit of a language change in it or something, but nothing really major. And something, in spite of the fact that over the years I have blogged about the National Certification Board, and I know all the folks there, and I've known the board members and the executive staff and everything going in and out for a very long time, and regardless of any other disagreements that I've ever had with them, I believe the National Certification Board has got the most thorough code of ethics and standards of practice in the massage therapy profession, and I use it when I'm teaching my own ethics classes. And I always say, do not let the fact that you are not board certified, or you're not an approved provider, or you may not have anything to do with the NCB. Their code and their standards are up on their website for the whole world to see. And I believe every massage therapist should familiarize themselves with those.
Absolutely. And it's so much easier when you have a good quality code of ethics and standard of practice that you can grab, understand nationwide, and that when you're looking at state licensure and putting down rules and concepts, that there's something that they can go back to. Now, that currently we've got several aspects. The entry-level analysis project is used in many states. The NCB standards. We have the Federation of State Massage Therapy Boards Model Practice Act. But a lot of these tools really help our legislators create quality government standards, governing standards, so that we can really be safe as massage therapists. And so reminding people that when you go to the National Certification Board's website, you go all the way down to the bottom and go to the Standards of Practice, is what we're going to be talking about today. So as you go to the Standards of Practice, we have done portions of Standard 1, which is professionalism. We've done A, B, C, and D. Today we've got E, F, and I think we have part of G to talk about. But I want to break these up piece by piece, because there's a lot of body in each one of these that really kind of are set down to say what you're supposed to do. I want to engage in the why you're supposed to do it. And so I think Laura and I have enough experience that we've seen good and bad on a lot of things and side effects and consequences, that I think we can have a good understanding and a good presentation of these types of things. So E, standard E, 1E says, provide an environment that is safe, comfortable for the client, and which at a minimum meets all legal requirements of health and safety. Laura, have you ever heard about or seen an environment that did not meet that standard?
Well, yes, I've been in some environments that did meet that standard, and I was just actually thinking about it the other day. You know, back in the dark ages when I went to massage school, you know, we all had those little 8-ounce jars of massage cream that we used when we were in class and everything, practicing on each other. And I honestly don't remember anything being said about cross contamination and not, you know, dipping your hand in the jar, to use a little spatula. Don't put your hand in the jar and put it on one person and then do it on another. I mean, things as simple as that. You know, I've also, back in the day when I was helping the owner of the massage school find the rules from other states, I can remember thinking that one rule was ridiculous. We tried to keep what was really good and throw out what was really bad. And I don't remember what state it was, but one state had the rule that your massage table could not be located further than 20 feet away from a bathroom. And I thought, really, does it matter if it's 21? I mean, I couldn't see how that was going to affect anything. But I've been in some folks' massage rooms that, you know, they look like a yard sale was taking place. It was cluttered, stuff in the floor. Somebody could have tripped over or just anything. And, you know, I will never make the claim that you can eat off the floor at my house, but all the years that I was in private practice, I could have definitely made the claim that you could eat off the floor at my office. I think I'm very serious about that because I used to get a lot of comments about how, you know, how clean and professional my office was, and that was always a big deal to me. And I think it makes it's not only to protect the safety and health of the client, but it makes a good impression on people as your image, for your image as a professional massage therapist, to have a clean and safe environment.
Yep. I know I was just recently at a new spa that was just opening. And of course, when you're at a brand new spa that's just opening that they've put a lot of money into, everything looks clean and precise and pristine. And the therapists are very excited because they're working in this new environment. And I had to point out one thing to those new massage therapists. A spa only stays new as long as you respect it and keep it new.
That's very true.
If you break it down, if you're not cleaning things, if you're leaving dust mites and stuff to hang out around, you know what? That's what wears and tears on the look and the experience of a spa.
Well, it is, and people work in so many different environments. I was just talking with a therapist the other day who asked me some advice about working out of her home. And I said, I brought that up about, you know, how you could eat off the floor at my office, but not necessarily at my house. And I said, if you're going to practice at home, that has to be the case. You have to keep that maintained just the same as if you were in a spa or in an office somewhere. You know, don't let your clients have to trip over your kids' toys on the way into the treatment room, and keeping your facility spotless and that kind of thing. It's just a big deal to me. I think it creates a little bit of distrust, or maybe gives people a lack of confidence in the massage therapist if they go into an environment that's, you know, not clean or cluttered and that kind of thing. I think it inspires trust and confidence whenever you do maintain a professional environment.
The environment is so important when you're starting to see different changes, and especially in the industry of massage therapy. The more we start seeing respect for not only your environment, but that then leads to an expected respect of the client, because that is just kind of a led to aspect. It's hard to, I think I was talking to a counselor many years ago, and the statement was, you can't respect others without first respecting yourself.
That's true.
And so if you're looking at respecting yourself as a professional, as a practitioner, part of that is respecting your tools, respecting your abilities, and respecting your education is all pieces of respecting yourself. And so a client who comes in we'll see consistency in your nonverbals and your verbals if you're doing things like this, if you're connecting with what is important and connecting with how you want the environment to look for them, because that means that you put effort in and they can say, yes, everything looks wonderful. You started out with the safety aspect of cross-contamination. And I love that example because it is so true when you look at continuing education classes from years ago. When you look at going to massage school and having them demonstrate something, sometimes the massage therapy instructor was a person who literally just learned it themselves a couple of months back, and they learned it from someone who learned it from someone who learned it from someone. And no one's really put in that concept of, wait a second, why are we doing this? And what can the side effects be? And that's, in my mind, as a board certified massage therapist, we're being asked to not just follow the rules, but to think about the rules, engage the rules, and create the understanding of why we should be following the rules.
Well, exactly. And, you know, I'm sure that we both have plenty of horror stories to tell, but one thing sticking out in my mind is a therapist who told me that she went to one of these massage cruises, I guess, where there are CE offered on the cruise. And she said, I was doing a hot stone class, and she said, you know, the sinks in the bathrooms and the cabins and everything on a cruise ship are tiny. I mean, if you've ever been in one, it's it's sort of like the bathroom in a bus or something like that. And she said there was just no convenient source for getting clean water. You know, it was very hard you're either standing there with a Dixie cup trying to pour it into your stone warmer, which certainly wouldn't fit in the sink. And she said, you know, I was horrified at the sanitation that went on all weekend because there just was no good way to wash your stones. You can, of course, pour alcohol all over them, but still you've got to have somewhere to wash those things out and wash your warmers and all that. And she said, I felt like I should be wearing gloves whenever I was touching anybody or touching my stones. But she said the stones were touching them. And she said, you know, it was really one of the worst experiences for CE that I've ever been through just because of the lack of cleanliness. So
I had never thought about that.
Yeah, and I mean, it may not occur to you that you don't know what skin conditions people have, and you don't know whether that's a pimple or a tick bite or what. You know, you just and a lot of times when people have a rash, well, you know, that could be contact dermatitis, or it could be something way more serious that's contagious. And so people do need to be careful and mindful of those things.
Absolutely. I've gone into several places as a person who's hired to come in and kind of do an assessment of facilities. Do that for the law as well for cases. But I know I've gone in several times and said, okay, so what do you guys do for cleaning and sanitation for each client? And I kind of get a little icky when they say, well, we take the top sheet off and we put a new top sheet on and we put the blanket on top. And I think, wait a second, that's not what the law's telling you to do.
Right.
The law's telling you that you have to have clean sheets for every client. That is the top and the bottom. Well, the oil only got on the top. No, no, it didn't. No, it didn't. You've got to take care of the cleanliness of the entire table.
You know, one of the most horrifying trends that I've heard about in the past few years is this practice of stacking sheets. You know what I'm talking about, and that I've heard that goes on at some, well, let's just say places I won't name, but I've heard that goes on where in a busy environment where a therapist is maybe doing one client right after another, that they put, you know, 4 or 5 or however many bottom sheets on the table, and then as the client leaves, they pull that sheet off and there's another one under it. That's horrifying to me. It's not a good practice. If you're whatever kind of massage medium you're using, oil or whatever, it's going to go through the sheet. and it's just not a good practice. Now, the other thing is you mentioned the blankets on tables. Now, you know, a lot of us have always been in the habit of having a top sheet and then also having a comforter or blanket or a quilt or whatever it is you use in your practice. Now, you know what? The client's touching that. You're sitting in a hotel room right now. You know, when I go into a hotel room, I want to know that I'm, number one, in a place that I don't have to worry about whether or not they have clean sheets. But those comforters are a concern to me, because do they change those for every single every single guest that comes in there? And I mean, you just don't know. I hear they have these like blue light things or whatever, you know, like the people on NCIS looking for blood that shows things, makes things. I've seen some of these videos. I'm sure you have too. But here's what's really in your hotel room. So yeah, you need to have a clean top cover for everybody, whatever it is that you're using. I always like to use flannel sheets. That, you know, usually necessitated you not having to use a comforter on top or whatever. And I always kept some throws and blankets around for people who, you know, if anyone was cold, that I could put on them. But you need to think about that, because if the average therapist doing, let's say you're doing, you know, 10 or 20 massages a week, and every single one of those people is putting their hands on whatever top covering you're using, your comforter, your blanket, or whatever, good Lord, you know.
And it's in the same place.
It is in the same place.
And yeah, it's a cross-contamination issue direct. I know the state of Washington, it's a cross-contamination issue direct. I know the state of Washington actually put that into law about laundering the other linens, including the blanket. And
yes.
For me, when I saw that, I was like, well, good. I'm so glad that they're starting to deal with these other issues that are definitely of concern. And there was so much uproar, and they had to do so much research on how much people will launder that blanket or the top cover. And I was like, you know, if a state licensing board wants to set something down and say, you know what, this is how often that has to happen, they need to say it, because it's for a safety and sanitation issue for client recognition. It's about keeping that client safe, and that is where I think licensing boards need to continue to hold true.
Well, they do. And you know what, I have served for I served the North Carolina board for 5 years as a member, and I've been a delegate to the Federation and been in the House of Delegates at AMTA, and, you know, tried to spread myself around and you know, and volunteer here and there. But, you know, in my experience of number one, being a massage student, number two, being a therapist for almost 20 years, and number three, traveling all over the country teaching, you know, I wonder how much time really gets given in entry-level massage school to educating people about those things. And I kind of feel like it gets shortchanged, because, like I said, it was a long time ago when I went to massage school, and I don't remember anything being said about cross-contamination. From judging from the behavior I've seen of some people who are a lot newer to this than you and I, maybe they didn't hear about it either. I don't know, but and it's kind of sad that that a state board would have to spell that out. You would want to think that it's common sense, but, you know, everybody just doesn't have the same amount of common sense, and people don't. I don't think anybody has ill intent. They just don't think about those things. They honestly don't.
My sweet mama was an elementary school teacher, and she's an outstanding person, and she always used to tell me that it's not what you teach in the lesson, it's in class, it's how you live that demonstrates what you teach for the lesson in class. Yeah. And I know so many times when I've seen massage therapy school, and I've seen this in continuing education as well, where they'll teach the safety protocols, and they'll say, okay, this is what you need to do, and you need to make sure to do this. And then they go about not doing exactly what they just said.
It's like, well, you just do as I say, not as I do.
You need to make sure to never cross-contaminate and touch two people. Okay, so I'm going to demonstrate this technique. Oh, you've got a question on that technique? Okay. And I'm like, wait a second, you're doing what you're doing.
Cross-contaminating.
And
Exactly.
so it is up to instructors to really hold on to, not just when they're teaching it, but when they're demonstrating the life expectancy for those activities that make it better. Now, there's one thing that I wanted to kind of bring up here that we may be instigating something. You tell me if you're not comfortable talking about it. But it's North Carolina current has some laws that have kind of been pushing around. And I want to kind of see your thought on this, because I was up in Raleigh, North Carolina when they had this meeting. And one of the big pushing questions on the docket was room size as a safety piece.
Yeah, you know something, I actually, of course, I've heard from hundreds of therapists in North Carolina who wanted me to come and scream and shout at the meeting or something, which I declined to do.
Very well.
I did think, I thought, you know something, when I heard that room requirement, I thought to myself, I would have been out of business myself, because in 2003, I believe it was, I opened a clinic in my town, and initially with just myself and one other massage therapist. And over the years, I expanded that business very greatly until the point where I had 12 people working there, and I had 3 adjoining suites of offices. Now, those were set up in kind of a funny way, because on the right-hand side of the hallway, the treatment rooms were 10 by 10. On the left-hand side of the hallway, the treatment rooms were 10 by 9. And under North Carolina's proposed new thing, that wouldn't have flown. And so, you know, there was, I think the general sentiment behind that upset people so much about that proposed rule was that they were claiming that, you know, if the room is smaller than this, you don't have room to do massage, you're performing sex services. And I went, really? I thought it was one of the most ridiculous things I had ever heard. And it certainly did get a lot of pushback. I heard that meeting was very crowded.
I was proud of our profession for that show up.
Yeah.
Because people, it is one of those things to say, okay, yes, it's good when people are outspoken, but it's really amazing when people have spirit and heart and are willing to talk about it. And
that's right.
And that's where I was pushing. I was so grateful for that.
Yeah, I know that myself and I'm sure a few hundred other people wrote letters to the board, you know, voicing our objection to that. Now, you know, something I am all about health and safety for and the protection of the client, but I actually thought that was a very unnecessary piece there that really didn't have any business even being proposed, basically.
Yeah.
much less passing.
Yep. And so being conscious of all of that, and I know, actually, FYI, the North Carolina board has already said that they've already dropped that piece.
Yeah.
That's not something that they're going to pursue. And so when we heard that, we were like, okay, that we're grateful that they've kind of connected with that and seen what that value is and the challenges there. There's one other piece on the comfort that I feel is just as important as just standard comfortability for how the room feels. I don't think this is talking about your air conditioning unit or your heating unit being able to get it to a certain degree. When I think of this comfort, I think of the psychological comfort. If I'm a massage client and I'm going to get on a table and I have a white sheet that's see-through as the top sheet, and I'm supposed to get under that sheet and lay down, I'm not going to feel very comfortable. And so being able to make sure that all these small aspects of your treatment room are there for the physical and psychological comfort of your clients.
You know something, I just want to speak directly to that, because I've had a lot, probably thousands of massage therapists over the years say, well, I don't know why I have to pay that money. I don't know what the massage board does for me. You know something, the massage board is not there to do a thing for you. They exist to safeguard the comfort the safety, the modesty, the well-being of the client. It is not about us. It is about the client. And so, you know, the sheet issue and safeguarding people's modesty. You know something, that there are people who have never had a massage. They don't know what to expect. They may be nervous about their body being not only seen but touched by, you know, when you think about it, what a huge responsibility we have. A total stranger walks in the door that we've never seen before. 10 minutes later, they're naked on the table or in some state of undress and covered up. And that is a huge responsibility for us, to make people feel safe and to safeguard their modesty. You know, draping rules are very specific in most of the regulated states. Now, in North Carolina, our law actually says the drape may be temporarily removed in order to apply treatment. You don't ever jerk a sheet down on somebody without discussing that with them. And I think we have to be very careful, because there is a power differential at play here. You know, the unclothed client is on the table in some vulnerable position. Our fully clothed body is standing over them, and they view us a lot of times as some sort of an authority figure, the expert or whatever. And they might feel uncomfortable, not only the fact that they feel exposed, for example, if they were under a white sheet, especially a male, if you're under some thin white sheet, you know, they may feel uncomfortable about that. They may feel uncomfortable about somewhere that you touch them, even if it's not a so-called private area or whatever. People have different reactions to different things. We really have got to be more than cautious about making people feel that we're guarding their modesty and that we are respecting their body and their psychological well-being. You don't want to traumatize somebody, whether it's their first massage or their 1,000th massage, by being careless and not being tuned in to what they need. Yeah.
Truth be said, majority of people are coming in with psychological trauma already.
You're right.
And you never know when you're going to unintentionally cross those psychological traumas. So you have to safeguard yourself in the best way possible to make sure that they're not feeling there's a discomfort, there's an intention that you may or may not have. And so I talk about the power of communication in ethics. If you have a client who has a misunderstanding of what massage therapy is, if they think massage therapy is related to sex, then as a licensed massage therapist, it's our job to first educate. We're not prostitutes. If that's what you're looking for, you need to go someplace else.
Right.
And that negates a lot of cases of inappropriate response. They may just go, oh, well, I didn't know, I'm sorry. And then you're done with the session, they've left, and you're free and clear to not feel like you've been sexually assaulted or sexually degraded or anything of that nature, because you have stood up for what you are and what you are not.
And I just want to say, you have to address that the second that it happens. Because if someone says or does something that's inappropriate and you let that pass, you have just given that person permission to carry on with whatever bad behavior they were, thinking of. And so it is very important to, take a step back and say, this is therapeutic massage. I am not providing any sexual services or listening to any inappropriate sexual comments. Would you like to continue under my rules, or would you just prefer to get up and leave? And by the way, you owe me $75. That would be the way to handle that. But you have to address it in the moment, and you also have to be so careful. Something the draping of people, for example. Don't be careless with that. Something during my 5 years on the board, I participated in many, many, many disciplinary hearings of therapists who had been accused of something. My question to myself was always, did this therapist have an intent to do something evil, or was this some stupidity, careless mistake that they just weren't thinking? They exposed a person, they said, told an inappropriate joke or did something dumb that made the client feel threatened. Now, I think a lot of therapists, I think the majority did not have any intent to do something wrong, but they were just plain careless. I will never forget one time when I was still teaching in massage school. We had a great big open classroom, and back in those days, there weren't even any, curtains between the massage tables on clinic day and that kind of thing. People would go into the bathroom and get undressed and come out in their robe or their sheet or whatever, and get on the massage table. And I was on the table one day receiving a massage from a male student. And so I'm face up on the table, and all of a sudden I felt this big breeze. And he had accidentally, the top sheet got snagged on this lotion holster that he was wearing. He pulled the sheet off of me, and there were 25 people in the room, and the majority of them were either focused on the massage they were doing, and the recipients were in the zone. I wasn't worried about who saw me exposed, but I thought that student was going to have a heart attack on the spot. And that's been 20 years ago. If I run into him on the street today, he'll start apologizing again for that incident. But it's something I did say to him later on in a private moment. I said, be very glad that that happened in public, and that it was me, and that I know that you didn't have any ill intent there. Because if something like that had happened in the privacy of the treatment room when you're alone with a client, that could have been a career-ending thing right there, and a board disciplinary hearing, and embarrassment of having your name on the board website, and all of that kind of stuff. So sometimes it's carelessness. Sometimes it's a plain accident like that was. I know he didn't intend to pull the sheet off me, but we have to be very, very mindful and very careful of how we are with people when they're alone with us in the treatment room. And no, massage should never be associated with sex. But you have to think about this, Nathan, and I'm sure you have as many times as I have. We're alone in an intimate setting with people. We've usually, unless you're in a doctor's office, usually the lights are dimmed, which is conducive to people relaxing. We got soft, soothing music, playing on the iPod or whatever. And it is, in some respects, a very personal environment. So that's all the more reason for us to be 110% diligent when we're in that environment with people.
I've been asked so many times to do an ethics class just for male massage therapists. And I thought about it, and I thought about it, and I thought about it, and I actually came to a conclusion that it's not a male massage therapist issue. It is our society and our culture has set up a kind of unique aspect that if there is something inappropriate that is addressed that a male does, and it's by a relationship, that power differential there that you were talking about, that goes to a legal aspect, and that goes directly to, hopefully, goes to the right case and the right portion for illegal behavior, and then it gets addressed legally. If a female is doing something, then most of the time it's that they get a name for themselves, and they then have to deal with the consequences of dealing with other people who are asking for the same behavior.
Right.
And it's not that it's any less important. Actually, I think the safeguarding of communication as a massage therapist is one of these big issues where if you're, and I've heard too many female massage therapists say this, oh yeah, I'll flirt with my client just a little.
No.
And that statement is directly against sexual communication.
Absolutely.
That's what you're doing it for, or that's kind of that piece that it's not focused towards the therapeutic session, and you're creating that perception of the client that there is a possibility of something inappropriate, and that hurts our profession.
It does hurt our profession. Now, all of the 13 years that I had my clinic, I did usually have at least one male therapist on the scene. I don't even know if you knew this or not, but my husband, Champ, who passed last year, Champ had been a licensed therapist for about 10 years. And so, I always said to him very early in his education, Champ, male therapists have a different road to hoe, and you always have to be, ultra diligent because my husband was a flirty person, he was a very tactile person. He would, if he saw
would flirt
you,
with me though.
Absolutely, he would, and he was. When I say flirty, I mean that he would tell everyone, male or female, he would always say, "You look beautiful today. You look great today," or whatever, and it just went around spreading love and light. And he was a big hugger. And I've also known a lot of women therapists. I had one incident at my office one time where one of the therapists who worked for me, she thought she had to hug everybody coming and going. And so one day she hugged this man, and he squeezed a little bit too tight and started kissing her on the face and saying, "I love you, I love you, I love you." Well, this man was from a different country, and I had a friend that was from that country. So I called him up and I said, "Look," I said, "I'm trying to find out if this is a cultural thing." I said, "If you were coming out from your first massage and the therapist hugged you," I said, "would you think that was something sexual, or that she was coming on to you, or what?" And he said, "Oh, absolutely." So I informed her. I'm like, "No, you just don't. You just need to stop doing that. If it's some long-standing client that that you've known forever, and they want to hug you, and you're comfortable with that, then go ahead. But you should not make the mistake of thinking it's okay to just hug everybody that comes into your office. That makes some people uncomfortable, and it may have already been a stretch for them to even allow you to put your hands on them to start with." So sexualizing behavior, that can be anything. That can be saying one inappropriate word. That can be the way you dress at work and the way you present yourself. Nathan, I've ticked off more than a few people. You and I are both on Facebook. We're big into social media. And I have privately messaged some therapists before and said, you are identifying yourself as a massage therapist on your Facebook page. I'm concerned that you posted this picture or whatever. If you're posting pictures of yourself, letting it all hang out, so to speak, and dancing drunk on the bar at your high school reunion, that's not making a good impression on people. And so if you're not identifying yourself as a massage therapist, then you can go ahead and show that video of yourself pole dancing. But if you are identifying yourself as a therapist, you're setting yourself up for problems to convey that image. One time when I was still a massage school student, I was giving a massage to a male student that was in my class, and at one point during the massage, he said, "Nice boobs." I jumped back and I went off, and he said, "Laura," he said, I said that because when you bend over, I'm getting a view." And he said, "I would rather for you to hear that from me than to hear it from some client." So you know what? Every morning before I left my house, I started doing the check. I would bend over in the mirror and see if anything was showing, because it wasn't a particularly revealing shirt or anything like that. But when you are bent over people doing the work, you don't want to be given in some a free shot or a show to people, and those are the kind of little things that people may not think about, And even though I was mad at him in the moment, and as soon as he explained his reasoning to me, then I was certainly over that and grateful to him that he called it to my attention. So
That's awesome.
Sexualizing behavior takes on a lot of different forms, and that's just one tiny example that certainly was not intentional on my part. But you got to be careful out there.
Well, and it's interesting right now culturally, the Me Too movement really does point out how many people have some sort of baggage regarding sexuality and touch, and what massage therapists really need to do, and the percentage of people who have had inappropriate touch in the past, we have to make sure to guard ourselves so that the client actually absolutely feels safe and comfortable on our table no matter what. I think we've all had massage therapy clients who have gone to a massage therapist and had a bad experience, and they're coming to you hoping not to have that experience again. And you're now entrusted not only with the expectation that you're going to give them a safe, but you're also going to give them a safe and professional massage that's not like that other person.
That's right. And something, it may be a really big deal in a client's life that they go to get a massage at all.
Yep.
And if they have had negative experience with somebody, whether that was sexual or whether it was that the therapist did something else that made them uncomfortable, whether that was in word or in deed, it could be anything from talking about things that are too personal, asking them questions that are too personal. My personal policy was always, if it does not have a direct bearing on the massage I'm giving, then I don't need to get into that with the client. Over the years, I saw some terrible things. I will never forget one time that I saw what was very obviously cigarette burns on a woman, and I did not mention those. I rubbed over them with love and care, and I thought if she wants to say something about it, she will. When we're talking about safety and comfort of the client, that is not just talking about how clean your room is or how properly the client is draped. It's talking about, there's a whole lot of things that are involved in quality of care and that are involved in that concept of safety and comfort. And I believe that includes having the utmost respect for every client, not doing things that they haven't signed on for and don't want. Now, I've had clients tell me that, their massage therapist walked around the table banging a little gong before they started the session and told the client that they were clearing their negative energy. Or people doing energy work on people that the client has no idea what that is and doesn't feel comfortable with that. And it was never discussed with them before the session. When you impose what you want to on the client, that is not being client-centered in any way, and it's not being concerned about their comfort. And I think that's where we all need to go. We need to have that always foremost in our mind, safety and comfort of the client.
Yep. And it seems like it's a divergence from the topic at hand, but it is so important in that aspect of psychological comfort. You can't really address it enough to say that you have a new human body on your table that's dealing with all the things that are in their life. And that can be everything from trauma, but it can also be just emotional release from stuff that's going on. If you've had your dog die recently, if you've had a stressful time at work, if you have just lost your job, if you've lost a spouse, if all of those things, when it comes to your physical body, there's going to be a physical aspect of touch that's going to be related.
I'm there because, it's been a year and a week since my husband passed away. Every massage that I have had since he died, I've pretty much had a meltdown on the table, and I have gone to, therapists that I've known for years and felt comfortable with, and I knew they were not going to be judgmental of me or try to psychoanalyze me, which is another thing that gets on my last nerve. I actually, I actually used to have it in my mind that I wanted to be a counselor. My degree is in psychology, and I did a 2,000-hour internship under two psychologists. I decided along about hour number 3 of those 2,000 hours that I'm not tactful enough to counsel people. But yeah, you need to resist that urge. Oh, crying out loud. If people are having some sort of emotional response, all you need to do is be present for them. You don't need to start giving them psychological advice. And I know a lot of therapists who have crossed that line. And so safety is a cleanliness issue, a sanitation issue, et cetera, and keeping the floor clean. Comfort takes in a whole lot more than that. So
yeah,
that has to be foremost in our mind all the time.
Well, and I was finding it interesting because actually the next one, which is standard 1F, we've covered already pretty much, but use standard precautions to ensure professional hygienic practices and maintain a level of professional hygiene appropriate for practitioners in the therapeutic setting. We've talked about the stones and the ability to clean hot stones appropriately. We've talked about the table and making sure that the table is clean. We've talked about the double dipping of lotions and creams. I love that when you look at a hospital, and if you're looking at working in a hospital, they have single-use packets, and that's what you use when you're going into that session for that patient.
That's right.
It makes sense. It really does for ultimate hygiene.
Well, it does make sense. And something, universal precautions should be used with everybody. No, we're not
universal.
Universal, and there are some massage therapists who are employed in hospitals. I wish they were employed in every single hospital, and I hope that one of these days that we'll get there. But if you're just working in your office, working out of your home, working in a hair salon, it doesn't make any difference. Universal precautions should be practiced with every client. And I mean, hand washing, for crying out loud. I mean, you would hopefully never go from one client to the other without washing your hands. And I mean thoroughly. I'm not talking about slapping them under the running water for a few seconds. I mean a good scrub like you're in the doctor's office.
A squirt of hand sanitizer doesn't work.
No, it doesn't. It doesn't. And so that's a big deal. Now, something, this kind of brings up another issue to me, in which is using gloves and finger cots. Now, if you make some sort of minor cut on your hand or whatever that, it is not a serious enough deal for you to have to miss work or cancel your clients, that still needs to be covered up. You don't need to be rubbing a client with an open wound. If you have and you don't need to rub them wherever there's an open wound. So if somebody has a localized injury or whatever that you need to avoid that area, then do it. But also think of your clients. Don't be putting your hands on people if you have some sore or some sort of open wound that you should be wearing a glove and covering up. That's just the correct thing to do. The other thing I want to address, since we're on this, and thank God flu season is over with. We're almost in the summertime. But something, I know many massage therapists who has gone to work sick because they needed the money, or that was what they said to themselves anyway. They're like, no, I need the money. I don't want to cancel a client. Folks, I'm very sorry. Call me up. I'll loan you $20 till payday or whatever. Don't go to work sick and risk making other people sick. And, I've had clients actually walk in the door that I sent back home because they were sick. I don't want to get it. And I certainly don't want to spread it around to other clients. So don't be some kind of martyr for money or have the attitude of, oh, I can't cancel her. She's been waiting 2 weeks for this appointment. Big deal. If you're sick, don't go. It's just as simple as that. And don't let a client wheedle you into it. Well, I had a fever, but it was over last night. No, if there's the slightest doubt in your mind that you might catch that and particularly spread it to other people, just say no.
So there are certain things about my education when I went to massage school that I was so grateful for. One of those things was I had an instructor who always pointed out, don't be a typhoid Sally. And I'd wonder, it took me a long time to kind of ask and say, okay, so what does it mean to be a typhoid Sally? And she's like, you know what? If you let one person come in with something, I can guarantee someone's going to get it. It may not be you. It may be your next client. It may not be that next client, but it may be the client afterwards. And then they started pointing out the concept, and this was 1999, 2000, 2001, right at the beginning there. And we hadn't had the transition in education for HIV and AIDS, but we had already had people saying, you know what? People who have HIV need massage therapy. They need to
absolutely.
And that took a weight off my back so quickly. But when that was stated, it really came down to, wait, if you let the client before you who has a major system problem, or they're sick, or they're contagious, and then your next patient has HIV, you're now responsible for that person because you have not sanitized your room to the standard where no one's going to get sick because of the environment that you are providing for massage therapy.
Nathan, people who are in any kind of compromised health, we have to be so careful of that. My husband was sick for 3.5 years before he died. His immune system was down way low. He'd been through chemo and radiation. And that always affects people, excuse me, and not just cancer, but or HIV, but any life-threatening, life-changing condition that people have. That is another responsibility that we definitely have to be very mindful of. This person is already in compromised health. They're entrusting me as part of their care. And I need to do the best that I can for them.
It's such an easy statement to say when people are coming in for a massage. Why are they coming in for a massage? Because they're sore, they're tired, they have aches, they have pains. Guess what your immune system does when you're sore, tired, have aches, have pains? You have a depressed immune system.
Yep.
So being able to work with a person who's on the onset of being sick, those are usually the symptoms of something coming on.
Yeah.
And so if you can keep your environment safe, that's going to reduce the likelihood that anything will continue that may be already in their system, but you will not be the one who is dispersing the pathogen that's causing the dysfunction.
That's very true.
Yeah, just being conscious for your client's sake. Now, I have had a client, and this was several years ago. She came in, she says, I'm not contagious anymore, but I still feel these symptoms. And first of all, I felt icky. And second of all, I then questioned my judgment. And I went against my common sense because it happens. Sometimes we do something stupid. I'm glad that I didn't have major consequences, but the key thing for me was when I was working on her, I told her, I said, here's the possibility. We work on you, the symptoms get worse, but the likelihood is that you'll get over it quicker because we're processing through the lymphatic system, we're processing all this stuff through to really kind of then have it be really bad probably for you for the next 24 hours.
Yeah.
Or you're already on the edge of it. You're right where you think you are, and you think you're getting on the healthy side, and so it would just push out the rest, and you'd start feeling better. I think you're in the first stage. She's like, I really want the massage. My plan is to do it. And so I did the massage. She went home that day and was deathly ill, just horribly ill for the next 48 hours. And then she felt amazing. But that was not what I should have done.
No, and
I learned my lesson.
Cancer education, cancer massage education has become a really, really big deal to me. And, I realized some time ago that the tiny amount of information that I got about working with people who have cancer or otherwise in some very serious state of compromised health was about enough to make me dangerous to the public. And so, after my husband got diagnosed, I took some online education from your friends and mine, a great oncology course that was contributed to by Ruth Werner and Tracy Walton and Gail McDonald and some other people. And so I started there, and then I started with the oncology massage, and then I actually created I have to plug myself here, I created a free course in the ethics of working with people with cancer, because I hear horror stories. Now, 25 years ago, we were all told not to touch people that had cancer, and that's ridiculous. There's no reason to avoid that, but, just as in you making the client feel worse there unintentionally, somebody who just had chemo this morning does not need to be getting a deep tissue massage from you this afternoon. No, you're not going to spread the cancer. You're going to exacerbate the heck out of their symptoms and make them feel like they have a raging case of the flu. And also want to point out that radiation makes the bones brittle. So if you're one of these people who thinks you have to crunch everybody to the bone, and maybe your client liked that in the past, but something, our clients are not educated to contraindications. And
absolutely.
That is why we have to be, and that is why we have to be very observant of them, because if somebody just, something, by the time my husband had 35 radiation treatments, I was paranoid for anybody to massage him except me, because I saw him come out of a massage. I saw him come out of one class, a CE class that he went to. He looked like he had been beaten and left for dead. I'm not lying. He was so black and blue. The next day, and of course, Champ had a platelet issue going on, yep. And he was black and blue. And I mean, I was so upset when I saw the way that he looked. And he said, well, it didn't really hurt while they were doing it. And your client may not know that it hurts while they're doing it, but you have to educate them and say, no, I would feel better if we waited until a few days after your last chemo session before we do anything like that. And you just have to stick to your guns. Sometimes we have to say no to the client, because it's up to us to safeguard their best interest. Because
you're the paid professional and it's your license.
That's right.
Yeah. If something goes wrong and you blame it on the client, a perfect example, my daughter and I were driving down the road, and my daughter told me, hey, Dad, go a little faster. And I'm like, you're not the one driving here. If I get pulled over, it's my license that's going to be ticketed.
Exactly.
You're not going to tell me what to do. That same way, we have a massage therapy license, and we are the ones who are trained to understand what we can and cannot do. Even if that is operating within your scope of practice in an area that you haven't received education, you have to be comfortable and safe enough to say, I am not the person who can do this. If you are looking for this type of treatment, I would refer you out to a specialist who really knows that technique, that modality. That could be oncology, that could be pregnancy, that could be myofascial release, it could be trigger point therapy, it could be reflexology, whatever it is. Don't falsely state that you can do something because you want to make sure to get that dollar.
That's so true. And something I said my education was enough to make me dangerous. I believe back when I was in massage school, I think we spent like 4 hours on working with people, cancer and people in other compromised health. I mean, what the heck is that? 4 hours, that is not enough to make you able to practice safely. Something, cancer, people who are sick, not just with cancer, but people who are sick, even if their immune system has not been totally compromised, they're under a great deal of stress, and their caregivers are under been there, done that. Their caregivers are under a great deal of stress. We just have to be careful about that. Don't add to it. Don't make people worse by doing something that you're not qualified to do. I honestly wish it would be in the law that if you have not had training in oncology massage, you don't need to be working with cancer patients. It is not that cancer massage is not a modality per se. It is mainly about observing contraindications for people and perhaps needing to modify what you've done in the past and maybe what they've been used to getting in the past. Champ loved deep tissue massage. There came a day when I went, honey, not going to work for you, but here's something that will work for you. I mean, it's not that you have to refuse to touch people altogether, but it's up to you to modify what you do and what they've always had. There comes the point in time when you have to say, I'm really not comfortable with this now, and I think we need to do this, and explain to them your reason behind that. They will ultimately respect you for being more concerned about their health than you are about making a dollar, especially if you have to say, no, ma'am, I'm not going to see you on the day you've had your chemo or the day after. Let's stretch that out to whatever. It's up to you to say no kindly and to educate the client about why you're doing that.
I appreciate that. That is one of those things that I have such a hot button for, of not only looking at the hygiene of this client and the best treatment protocols for all of those, but it really circles all the way around to no matter what state they're in, no matter what condition there is. In massage school, you were taught pathology. That didn't make you an expert in any of those pathologies.
Nope.
However, it did give you enough to be scared about it. And being scared about it is a healthy thing.
Yes, it is.
Because when I look at continuing education, there's a couple of different pieces that I look at. Pathology-based continuing education. And looking at and that's what I would categorize oncology massage, is more of a pathology-based continuing education, where you're getting the science and a lot of times the hands-on expectation of people who have thought through the process to make it best practices. Then you get modality-based continuing education, where they focus on doing something a little different, working something a little different, using your feet or standing on your hands or whatever else that specialty is. And there's a lot of those, and those are such different classes. And if you ever go to a modality-based continuing education class and they say, oh, well, this technique helps with cancer patients, it helps with pregnant women, and helps with people with GERD, and helps with, I'm sorry, you're not in a pathology-based continuing education class. Go to a pathology-based class and get the education from them. Laura, I'm going to send you this wonderful message that we've had. We have had a wonderful time. I appreciate, Laura, I appreciate you guys watching. You guys have had a wonderful supportive statements of, you know what, it's good to have someone talking about ethics and massage therapy on YouTube and on Facebook. Please feel free to comment, connect. We get those messages and we strive to respond to every single one of them. We appreciate it. My guests appreciate it because they get an opportunity to connect with you. If you haven't, once again, as I said, Laura's been doing a lot of things in the massage therapy profession. I know continuing education is one of those. If you have an opportunity, have interest in what she has to say, I think she's in several of the magazines. If you search her website, search for Laura Allen, you'll be able to find out what her website's doing, where she's going, what she's up to. Thank you, Laura.
Thank you, Laura Ellen. The hour has flown by. We hope you've enjoyed this discussion with Ethics Outside the Box. As you've seen, Nathan uses many second-hand stories of ethical situations. If you'd like to share your story or you have any questions, feel free to contact him and Nathan at educatedtouch.com. If you'd like to register for next week's live webinar, go to shop.educatedtouch.com. Under live webinars, you will see all upcoming webinars. If you have just watched this video and would like continuing education for home study, you can go to shop.educatedtouch.com under the home study options with the date or episode number to receive your exam. If you would please like this video and subscribe to our YouTube channel, we will keep you up to date on new videos. If you'd like to attend one of our live courses, you can find upcoming scheduled events at www.educatedtouch.com. Thank you for joining us today.